I came to Charlotte in 1973. In the early 2000s, recognizing that there was a severe crisis in terms of affordability of health care, and I saw the need for the establishment of a company that provided affordable and patient-friendly alternatives.
AccessOne is a technology company, but at the end of the day, we help families afford the health care they need to live their healthiest life. We do that through a technology program and a partnership with health systems to provide financing tools that any consumer can use to get the care they need when they need it. We're a tireless ally for the patient consumer. Long before my time, AccessOne began working with Atrium Health. This goes back to one of the first few clients of Dr. Sultan's as he was starting and growing this company. Atrium Health's willingness to innovate with us, to share ideas, has been very impactful.
Several years ago, AccessOne decided that an area where we could perhaps make the greatest impact would be to contribute to Atrium Health's efforts in the area of behavioral health. Behavioral health issues include everything from alcoholism to drug addiction. They can affect anyone at any age, of any ethnicity.
I think it's rewarding to partner with, an entrepreneur and a social activist like Dr. Sultan, who has a heart for the consumer, and he just won't quit until he gets to what he believes is right.
Telepsychiatry is a form of virtual behavioral health care. It allows psychiatrists and other behavioral health providers to reach out into primary care physicians' offices, to emergency rooms, and to other locations throughout the region. The effect of this technology will allow for earlier treatment, more effective and speedier outcomes. All of us at some time during our life interact or have behavioral health issues. The recognition and early treatment of these issues is so important to the community that your contribution to these poorly covered services will be significant and have an immediate impact.
I think we chose Atrium Health Behavioral Health because it's really tough to separate behavioral health from overall health in the community. I think because it's as important as heart, is as important as cancer, is as important as primary care, because it's all the same. It's our health, and making sure we have the resources to help at every level is important to a functional community. It's important to a growing workforce. It's important to a community with so many great things going for it, like Charlotte, and we believe it's one that deserves as much resource that we can give it.